It is important to start with a well hand wash technique lasting 15 to 20 minutes. To prevent cross-contamination, proceed to walk in patient providing with the best knowledge, making patient understands well the needs and risk of taking X-rays by signing a consent form. Securing no pregnancy when taking on females, starting by seating our patient on our upright position, being well positioned, ready with equipment and working surface. We will place a safety apron for protection on exposure of radiation on patient. Always ask your patient permission on any type of approach. Very important to secure arms inside apron. We will start by placing personal protective equipment such as mask and gloves for protection of hazards or injury. Starting with the paralleling technique on the right maxillary molars. Using the yellow tap for posterior teeth. Using a XCP holder, we will use a universal ring and arm and yellow film holder. The film should always be well centered. The dot should point mesial. Preparing for bisecting technique, we will place film in snap array. Plain side facing buccal and the dot towards mesial. Placing the tube in a 90 angle to an imaginary line that bisects between the long axis of tooth and the film. This technique is mainly used for maxillary canine or first and second molar, shallow palate, narrow arches, loss of alveolar bone or presence of tori. Considering not enough angulation creates elongation and too much angulation causes foreshortening. Following with the bite wing technique, also known as the interproximal technique. Having a total of 4 images, 2 on the left and 2 on the right. Always parallel to the floor and place it enough toward to get maxillary and mandibular. We will start using XCP holder, getting the premolars and first molar. This is used to detect tooth decay, as is periodontal disease, and monitor. XCP holder helps with alignment. This technique requires a plus 10 degrees horizontal angulation. The bite wing technique can also be taken with bite wing tabs. Having a film and sticking a tab into the plain side of the film, making it easier to assemble and discard after. Using a film size 3 or 2. Plain side facing buccal and the dot facing mesial. The bite tab makes it easier for extra support on making a fold to hold into the tooth. More comfortable for patient and easier to manage for taking X-rays. Helping center it with the edge of the film and the edge of PID. Finishing with a bite wing, we will use a bite loop. This is a dental tool used to hold a dental X-ray film or sensor in place during a bite wing radiograph. It consists of a loop or a wing-shaped device that the patient bites down on, holding the film or sensor securely between their teeth. This ensures a clear and precise image of the teeth and surrounding bone structure. Contemplating the 10-degree angle. We will place the tab centered into the molars or premolars, showing the maxillary and the mandible in one image. What helps alignment in this tool is having edge-to-edge with the film and the position indicating device. After ensuring with radiographs making sure they're clear and usable, we can proceed to move patient into the next step. Removing safety apron and carefully release patient.